Hello, good afternoon, good night, doctors, nurses, and pharmacists. I'm Dr. Che, and today we will discuss writing. Okay, so just let me share the session with other doctor, nurses, and pharmacists, and then we can start. Okay, just 1 minute. Just 1 minute. Okay, so if you can hear me, just let me know. Just let me share the class. Then we can start. Okay, just quickly, please. Just 1 minute, please. Okay. Thank you so much, all of you. Just to make it clear that I work in a hospital, so sometimes I get a little bit busy. That is why we can change the class timing a little bit. Okay, so today we will discuss very important writing tips. Thank you so much for your likes. Okay, so let me just see. I just wanted to take all of you on Zoom, but I was busy. That is why I could not share Zoom class. Otherwise, I should have shared Zoom class. But anyway, okay, so let us test. If you can share the session with other doctors, nurses, and pharmacists, that would be great, please. Okay, so let us start. So here are the case notes, and we will try to write a letter. Okay. Okay. So when you will get your writing task, you will have 5 minutes reading time and you will have 40 minutes to write your letter. Okay. Please note it down that in the real exam, you will have 5 minutes to read the task. 5 minutes. I will teach part B. Okay, Miss C.B. Thomas. I will teach part C, but part B. I have my own samples of part B, but later on. Today is writing, tomorrow is speaking, then we will again do the. So in the real exam, these 5 minutes are reading time. Anybody can tell me that, can you write anything or underline the case notes in these 5 minutes? Can you underline the case notes or you can write something in these 5 minutes? No. Okay. So please remember, in these 5 minutes, even you cannot pick up your pencil. You will only be able to write with lead pencil. Okay, lead pencil. But even in these 5 minutes, you will not be able to pick your pencil. Okay. Pen down, just reading. Very good. Very good. Okay. Pen down and just reading. Very good. Okay. So now let us try these 5 minutes. Okay. To read the task. Okay. Let us make it 180. Okay. You are a doctor or a nurse at Newtown Hospital. Read the case notes below and complete the writing task which follows. After that, what we should write? We should read the patient details or we should go somewhere else. After reading this, where we should go? Just imagine you are in the real exam. After reading this, where we should go? After reading this, where we should go? Task, very good, very good. Somia, Dr. Somia, very good. Dr. Sidra, Dr. Hazel, very good. Miss CB Thomas, very good. Dr. Nadeem, very good. Excellent, all of you, okay? Why? The reason is because we should know to whom we are writing, okay? To whom we are writing, and we should note the situation, what kind of letter it is, what would be important to mention, what would not be important to mention in this letter, okay? So here we have writing task. Using the information in the case notes, write a letter to patient's primary care physician to update about patient's condition and treatment and for follow-up care. Okay, so this is the GP, Dr. Che, general practitioner, Greenfield Family Practice, 555. Okay, OET Expert Street, Manchester. Okay, this is my own case notes. So that is why I have written here. So this is your task. It means patients were admitted. Now, so you are sending this patient back to your family care physician. Okay, it can be community nurse also in case of nursing. Sometimes nursing can write letter to GP also. So this letter would fit both for both of you, for doctors and nurses. So is there anything specific in the task that is very important to keep in mind? A thing that is very important to keep in mind in the task. Anybody can tell me what is the most important thing in the task to keep in mind while writing this letter? Any important thing that we should keep in mind? Update, yeah, it is important, but not. Very good, Miss CB Thomas, very good, excellent. Known patient to GP, very good, Dr. Nadeem, excellent, okay. The GP knows the patient, very good, okay. Now, keep in mind that you are writing back to GP. This is a what kind of letter? Referral letter, urgent referral letter, discharge letter, transfer letter. Okay, which kind of letter it is? Which kind of letter it is? Which kind of letter it is? Ms. Naseem Akhtar says, as primary education knows already, so need to give the update only. Very good. So which kind of letter it is? Discharge letter. Very good. Excellent. 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 All of you. Very good. Very good. Excellent. Okay, now let us go to the task. The case notes. Okay. You can see a lot of information here. 3 pages. You can get like this in the real exam, long case notes. So here is the name of the patient, Miss Jing Walter. This is my own invention, not a real name. This is the date of birth and age of the patient. So we have written both two things, age and date of birth. What we should write in our letter? Date of birth or age? Age or both of them? What we should write in our letter? Date of birth or age? Date of birth or age? What we should write? Okay, write one of them. Both are okay, but one of them. Okay, you can write date of birth, you can write age. I would prefer to write age. Okay, a little bit quick and easy to understand, but you can write date of birth or age, but don't write both of them. Why I have written both of them here? Because some of the students, they write both of these things. Just write one of them. Okay, or what you can do is write date of birth in the greeting part and you can write age in the purpose. Okay, but anyway, both are okay. This is address of the patient. Do we need address of the patient anywhere in your letter? Address of the patient. Do we need address of the patient anywhere in our letter? Do we need address of the patient anywhere in the letter? No, very good. Excellent, excellent. Do we need my WhatsApp number in letter? No, no, this is just to advertise, okay? This is my WhatsApp number. You people know, you people have my WhatsApp number, yeah? Okay, these are my own case notes, by the way. This is admission date, this is discharge date. Just you need to keep in mind, you don't need to write this. This admission date is 18th, 12/20 and discharge date is 02/01/21. Okay, admission date, discharge date. Okay, then we have social background. Patient is married, 35 years. 35 years is not the age of the patient, means married for the last 35 years. Okay, and she has 2 adult children. One son, Peter, lives abroad. Daughter, Diana, lives with mother. Lives with husband, Tom Rogman. This is her husband, 58-year-old retired army officer. Drinks 20 units of alcohol per week, usually vodka. Smokes 5 cigarettes per day for 10 years. Okay, what do you think about social background? Do we need anything in the social background to write in the letter? No need a family history? Do we need anything from the social background? Okay, already known about his social background. Okay, okay. There may be something depending upon the case, what will come further. There may be something, but usually we don't need. Just keep in mind that usually we don't need social background, but it depends upon the case. If the case is something about social problem, then you may need something. Okay. If the case is about social problem, then you may need something. Okay. Family history: father lung cancer, mother diabetes, a moderate family history of mild depression, sister, uncle, and aunt. Is there anything important in the family history? No, there is not important, Dr. Yusuf Zai. It is not important to mention the age again. But if you mention it is okay. If you don't mention it is also okay. It's optional. Okay, family history is not needed, but important thing is if patient has depression, then it may be important to write the depression. There is no still 100% that family history is important or not. It will depend upon the case note, the situation of the patient. This is past medical history of the patient, 1973. Appendix was removed via open abdominal surgery. Is it important? Appendix? Appendix? 84, acute bacterial sinusitis treated with augmentin BD. Is it important? Okay. So then we have bacterial sinusitis in 1984. This is not important. In 2018, tinea pedis treated with oral miconazole. Is it important? No, not at all. March 2020, insomnia takes zopiclone. Takes. What does takes mean? What does takes mean? These are my own case notes. Why I am using present tense here? Takes. Takes. No operations here. Insomnia takes zopiclone. Why? Why takes? Why takes? She is still taking. Very good, Dr. Nadeem. Excellent. Excellent. She is still taking. Do you think it can be important to mention? It can be important to mention, okay? It can be important to mention. Now let's go to first visit. First visit was on 5th of December 2020. Patient presented to emergency department with watery diarrhea, 3 episodes of vomiting. Just no, concentrate on the case, please. Concentrate on the case, please. Patient presented to emergency department with watery diarrhea, 3 episodes of vomiting, high grade fever, nausea, was depressed as her daughter Diana failed in annual exams. Okay. Daughter failed, but mother is depressed. Acute enteric fever was diagnosed. IV fluids, ringer lactate, metronidazole, IV, BD. Patient responded well to antibiotic and was discharged on this date. Okay. Just let us read. Okay. This is 5th of December. Then this is my WhatsApp number. Okay. You people have my WhatsApp number. Okay. Then 18th of December 2020, police report of an incident of domestic abuse. Now it is police report of domestic abuse. Patient was sleeping in her bedroom. Her husband pours a bottle of acid on her face. 7-year-old daughter Alexia started screaming. Neighbor called police. Rogue man was arrested. Who is rogue man? Who is rogue man? Her husband. Okay. Her husband was arrested. Jing Walter brought by ambulance to emergency department of hospital. Has severe pain, redness, burning at affected sites, face, head, and neck. Blisters seen on right side of her face. Okay. Respiratory symptoms is shortness of breath. Examination, pulse, this respiratory, this BP is this, temperature is this. On general inspection, white and black blisters of 1 to 3 centimeter on face. There was redness. Treatment, silvazine dressing, acid was removed from our skin, close with water without pulling on the skin. Silvazine dressing was applied, morphine was given, ciprofloxacin was given, and tetanus vaccine booster dose was given. Okay, this happened on 18th of December. Then on 25th, there was good improvement. Patient was still having pain, tingling on face. These were the vitals. This is my WhatsApp number. Physical examination, respiratory normal, cardio normal, fever normal, multiple scars of 1 to 2 centimeter on her face. Patient was depressed, referred to hospital clinical psychologist for counseling and emotional support. This was done on 25th. Then on 30th of December, patient complains of feeling depressed, no interest in life, wants to die due to scarring of face. Refer to plastic surgeon to review for possibility of plastic surgery. On 2nd of January, patient is feeling better. Agree to go her mother's home, not to her husband home, to her mother's home. And this is the discharge plan. Plastic surgery planned on this date for scarring of face. GP visit twice weekly for monitoring of suicidal thoughts. And GP needs to monitor compliance with oral mirtazapine, 15 milligram tablet once daily. Okay, this is for depression and insomnia. Diagnosis is second degree burns plus post traumatic stress disorder, and the reason is domestic violence. Okay, so we have spent now 5 minutes. This is just quickly, you will do in the exam quickly because I'm just teaching also. That is why I'm going through slow. Otherwise, you should have done this very quickly in 5 minutes. In these 5 minutes reading time, okay? Then you plan in your mind what you are going to write, okay? So then you need to plan in your mind what you are going to write, okay? Okay. So now let us go to the visits, okay? Visits. Let us see if it is something you told me that social background is not important. Just okay. So just let me know that you told me that these things are not important. Just let me know that this visit of 5th of December, read it quickly, and let me know that is it important to mention or not. This visit, please. I'm coming back in 2 minutes. I need to see a patient. Just 2 minutes, okay? 2, 3 minutes. Just read this visit and this visit and tell me which one is important to write. We should write both of them or one. Okay, so thank you so much. Okay, so let me see what you have done. Okay, 18 December is reported. I mentioned depression. 15th, no mention anything from 5. This depression is not something, too much depression like something chronic. This is just depression when somebody fails in exam. There is some little bit, depression. That is not any big problem. Okay. So focus on recent visit. Very good, Miss Thomas, Miss CB Thomas. Very good. Okay. So we don't need to mention this 5th of December visit. No, the trick is here. It is very important to know the trick. This is totally irrelevant visit. Why? The examiner has added this irrelevant visit here. Why? Why? Anybody knows why? Why the examiner has added this irrelevant visit at the start? Why? Why? Why this irrelevant visit at the start? Why? Okay, people, you don't need to mention. This is not medical exam, please. This is not medical exam. Dr. Yusuf Zai, this is not medical exam. You don't need to mention even not a single sentence about this visit, okay? If you mention this, if you mention this visit, if you mention this visit, you will not get B grade. Believe me. If you mention this visit, you will not get B grade. Believe me. If you write in a perfect letter, your English is very good, excellent. But if you mention this visit, or if you write about this visit, you will not get B grade. Believe me. Yeah, this is candidate's ability to see whether he is, he knows how to write that letter in OET or not. So here we need to make things, okay, summarize, okay. Excellent, okay. So now we have, so here at the start, this appendix is not important. Sinusitis is not important. Tinea pedis is not important. Insomnia, we will just briefly mention that she has insomnia and takes zopiclone, okay. And here, family history is not important. You can mention moderate history of mild depression in our sister, uncle, and aunt. Otherwise, lung cancer and diabetes is not important. Here, in social background, is it anything important to mention in the social background? Yes, you can mention a little bit because this is a social issue. This is a social issue. You can briefly mention just 1 to 2 sentences about her husband, okay? Especially about her husband. If you don't write, that is not a problem. But if you can write a little bit about her husband, that would be better, okay? Just briefly, okay? Now we have the main thing is this visit of 18th of December visit. This is the main visit, very long visit. Then we have 25th of December visit. This is just brief visit. You can see just one, two, three, four, 5 lines only. Then 30 of December, just 2 lines, and then discharge plan. Okay, this is the same date, the discharge plan. This is our main letter where we will write our main things. Okay, so now let me ask you some questions. Okay, question number 1. You already told me this is discharge letter, so we should follow while writing this letter. So in this letter, we should follow chronological order of importance. Please let me know, please, quickly. Should we follow chronological order of importance in this letter? This is question number 1. And okay, question number 1 only. Okay. So let me see what you have told me. Order of importance or chronological order? I cannot see any comments, please. Order of importance. Why order of importance? Why order of importance? Why order of importance? Why? When we use order of importance? When we use order of importance? When? When we use order of importance, please. Why order of importance? Why? Is this urgent letter? This is a discharge letter, please. Okay, so in this case, we will not use order of importance. We will use chronological order, please. Okay, this is discharge letter. We will use chronological order, please. No order of importance, please. Okay, so here is the diagnosis, and here is what we want from the reader. Here is the diagnosis. Please write. Patient's name is Jing Walter. Patient name is Jing Walter. Jing Walter. Age is 65. And here is the diagnosis. Here is what we want from the reader. Writing tasks. Please write the purpose. Please, all of you, write the purpose. Write the purpose, please. Write the purpose, please. Write purpose. Okay. You have 3 to 4 minutes to write the purpose, please. Okay. Okay. Age is 60. Okay. Age is 60. Jing Walter. This is the diagnosis. This is what we want from the reader. Write the purpose, please, quickly. Write the purpose and send me in the chat. Okay. Write the purpose, please. So if you have finished your purpose, I will show you how to write the purpose. But meanwhile, please try to write the first visit. I'm coming back. I have some patients. So let me show you first visits. So here is the complete first visit. Please try to write the first visit. I'm coming back in 4 to 5 minutes. So I will write, I will tell you how to write the purpose and how to write this visit. So please write in the chat how to write this visit. So if you can write the visit, but please make it concise. You can see there are many lines, too much information. So please make it concise. I'm coming back and then I will write this visit. Okay. So if you have finished the purpose, then write this visit, please. I'm coming back. I have some patients. Okay, so let us continue. If you can hear me, just let me know, please. Okay, so, okay, let us see. Okay, so I can see, okay, very good. Dr. Nadeem, I am writing to update you regarding Miss Walter, who has been treated for second-degree burns and post-traumatic stress disorder due to domestic violence. Very good, Dr. Nadeem, your follow-up care would be highly appreciated. Very good, Dr. Nadeem. On this day, Miss Walter was brought to the emergency department. Emergency department is written in capital, E capital, D capital, after her husband poured a bottle of acid on her face. Very good, Dr. Nadeem. She had severe pain, redness, and burning, and a burning sensation. At the affected sites. On examination, she had dyspnea and 1 to 3 centimeter of black and white blisters were present on the right side of her face. The verb is being used 2 times. Please write 1 time she was managed accordingly, and the acid was no need of manage accordingly is not needed. Okay, and the acid was removed from her skin and clothes with the help of water. With the help of water, no, Dr. Nadeem, please. Okay, with the help of Dr. Water, no. This is very informal way. And a silvazine dressing. Silvazine is written in capital, Dr. Nadeem. Silvazine in capital was applied. She was given morphine 10 milligram. No need to mention, Dr. Nadeem, the dose and frequency. Just write the name of the medication. She was given morphine and ciprofloxacin, and a booster dose of tetanus was administered. Please, no need of too much details. Okay. So now let me copy your, okay. So let us read from here. Let me make it bigger. Okay, I don't know how to do this. Okay, hello. Yeah, can do like this. Okay, I think this can work. Okay. So Miss Naseem says initially on this date, the Miss Naseem Akhtar, we don't need to write the December in words. So just 18/0, 18/12/21. Please no need to write the month in words. Okay, Miss Walter was brought to the emergency department. Very good, you people. All of you can see Miss Naseem has written emergency capital, E capital, D capital. By police after her husband poured a bottle of acid on her face. Okay, she had shortness of breath, severe pain, and a burning sensation. Very good. By the way, she is one of my students. Okay, Miss Naseem. She has taken my VIP hybrid course. So she is writing good. Okay. On examination, white and black what? White and black blisters of 1 to 2 centimeter would look better, Miss Naseem. White and black blisters of 1 to 3 centimeters were noted on her face. She was commenced on morphine and injection. No need of injection, Miss Naseem, please. No need of injection. Okay. She was commenced on morphine and ciprofloxacin. And okay, let me copy this. Let me copy this. Okay. So can anybody tell me what is the problem with these two sentences? Can anybody tell me what is the problem? These are two simple sentences. Subject, verb, and object. Okay. These are two simple sentences. Okay. What we can do is, instead of writing two simple sentences like this, we can join them together. Let me try, okay? Injection, we don't need to write injection. She was commenced on morphine, ciprofloxacin. Then we can use comma, and her wound dressing was done with silvazine. Okay, like this. Now you can see what is the difference. What is the difference between these two? These are two simple sentences, and this is one compound sentence. And this is well organized, easy to understand, means little bit higher level. So if you write the sentences like this, you will get C plus maximum. In case of nurses, you will get C. If you write compound sentences, good sentences like this, you will get B grade, okay? So this is the difference. Okay, now we have here, okay, Miss Pari Pari, she is one of my students. She has taken, get correction with me for many letters, I think so. If you are the same, okay, let me check your purpose. I'm ready to update you, not this you. Okay. Just, I'm ready to update you regarding Mr. XYZ. Okay. His miss. Who was between second degree burns, burn, no. These are burns, not a single burn, and PTSD due to domestic violence. Very good. She is being discharged today and would be required. Okay. Can anybody point out any mistake in this sentence? Anybody can point out any mistake in this sentence, please? Anybody can point out any mistake in this sentence? She is being discharged today and would be required your services for her ongoing care. Can anybody point out any mistake in this sentence, please? Can anybody point out any mistake here? Very good. Would be required. Why we are writing would be required? No. Would be required is wrong. Okay. Would require. And this your services for her ongoing care. This is a little bit, not in common way. What we can write and would require your ongoing care. Just write like this and would require your ongoing care. Would be required your services for her ongoing care. Ongoing is not one word. This is not two words, one word. Okay, ongoing care. Look the difference. Okay, and would require your ongoing care. This is advanced level. This is same thing but little bit better, and would require your ongoing care. And would require your ongoing care. Okay, so now let us move. Okay, I don't know how to move comments. Let me see how can I see all the comments here. Okay, let me try here. I'm a little bit, not good at technology. Okay, let me try here. Okay, let us take Dr. Yusuf Zai. Okay, let us take Dr. Yusuf Zai. The problem here is, no, it is okay. Okay, doctor. So first of all, 69 words, it almost okay. Okay, Miss Walter was brought to emergency department. Emergency department should be written in capital, Dr. Yusuf Zai, please. After victimized by. So what do you think people after victimized by? Can anybody correct it after victimized by? Can anybody correct this one after victimized by? This is grammatically wrong. After being victimized by, but this is not good one. Okay. After domestic abuse by her husband, after being victimized by, okay, not good word. Okay. By her husband with pouring bottle of acid on her face. With pouring, this does not fit very well here. On physical examination, business. Okay. Okay, bruises. This is bruises. Okay, while black blisters were present on her face, hands, neck, and shoulders. Their blisters were not here on all the places. She was in severe pain, and blisters and this is wrong sentence. Initial management include removal of. This is not good language of. This is not a good means sentence. Removal of acid from the skin and clothes, silvazine dressing, administration of ink, injection morphine, 10 booster dose for vaccine. Okay, you people can see Dr. Yusuf Zai, how many things you have written in this letter? How many things? How many things you have written in this letter, in this sentence? How many things? A lot of things. Initial management, removal of acid, skin, clothes, silvazine dressing, morphine, booster dose, ciprofloxacin, antibiotic cover. Please, please, if we write the sentences like this would not be easy for the reader to understand. Please, make it clear, make it easy, make it clear, make it easy, please. Okay. Let me show you here if anybody has written here. Okay, I don't have here. We can easily write, okay, very concisely. Okay, I will show you here. Okay, I will show you. Okay, how Miss Naseem has written. Okay, so Miss Florence, let us see yours. Okay, so Miss Florence, Miss Walter was admitted on the. Do we need article with date? No. On this date, presenting with, just due to presenting with is not, does not fit very well here. Severe pain, redness, burns on the face, head and neck, and some blisters on the right side of the face. This is too much things. Please make it concise, please. On assessment, the vitals were okay. This is not good way. Vitals were okay, no. Except low blood pressure and pulse. This is not good sentence. She was given morphine and antibiotic. Okay, so this is not good. Miss Florence, please improve. This is not good. Please improve. Okay, so no, Miss Nasim done. Okay. Miss Jenny is there. Miss Jenny, Miss Jenny, Miss Jenny, are you there? Please write in the chat. If you are there, write something in the chat so that I can see your Miss Jenny. Are you there? Yeah, okay, good. Excellent. Okay, Miss Jenny, on the 18th, just write the complete, okay, 18th, 12, 20, Mr. Rogman was detected in police custody following the crime of domestic abuse. This is not good, not needed. He poured acid on Miss Walter's face, the scream of Alexia, her 7-year-old daughter. We need comma before and after the explanation of the Alexia. Alerted the neighbors, which led to his arrest. Miss Jenny, you need to make things easy. Easy, please make it easy. Easy. Neighbors, which led to his arrest. Miss Jing Walter was rushed with an ambulance by an ambulance with no by an ambulance to the hospital via the A, presenting with severe pain, redness of the affected burnt head and neck, blisters all over. You can see how long this sentence is. This sentence is too long, Miss Jenny. Please, please, this is too long. Another Shiva the snake, pyretic, and no, pyretic, the snake, pyretic is not good here. Even this sentence is not good. So, Miss Jenny, you need a lot of improvement, please. Lot of improvement, please. Okay, we need a lot of improvement. Okay, Hazel, Mr. Hazel is there. Are you doctor or nurse? Are you there? Are you there, Hazel Pai? Are you there? Tomorrow, Miss Jenny, I will show the model answer. You can see the model answer. You can compare with model answer. Mr. Hazel is there? No? Okay, on 18th December, Mr. Walter had experienced. Do you think we need to use had experienced here? Just experienced. Had experienced? No. Acid attack on her face by her husband while sleeping. It was reported to police as a domestic violence case. Very simple sentence, please. Initially, we need comma here. She was experiencing severe pain, redness, and a burning sensation on her face, head, and neck. While the blood blisters 1 to 2 centimeters were noted, please, were noted on her face. Consequently, she was commenced on ciprofloxacin. No need of this, please. No need of details of medication. No need of details of medication, please. Dr. Hazel, no, please. Okay, so here we have Dr. Vinod Hasija. Dr. Vinod Hasija, are you there? Dr. Vinod Hasija, are you there? I will only mark those people who are there. Otherwise, I will not mark. Are you there? No? Quickly, please. Quickly. Yeah, okay. Okay. Miss Wilter was presented to emergency department when her, actually if we are using was presented, then was presented by ambulance, was presented by somebody, okay? So this is not good here. Passive voice is not good, okay? Was brought to emergency department by ambulance like this. When her husband poured a bottle of acid on her face while she was sleeping, on her daughter's screaming, police reported the incident and arrested her husband. Reported the incident does not fit here. On arrival in AE hospital, this is not good. Not good. She was noticed to have severe pain, redness, burning sensation at affected site, including face, head, and neck with blisters mainly involving right side of it. Yeah, please don't make it too long. Don't make it too long, please. Chambers with respiratory of 18, and while the rest of vitals were within normal range. You have not written anything about management. You have already written uh, 84 words, and still there is no management. Please, please improve. This is not good, okay? Still you are on examination and it is already 84 words. It is too long, okay? If we write the treatment and these things, it would become more than 100 words. It is too long. Okay, Dr. Nadeem. Okay, so let me just quickly read from here. Your purpose only. Oh, I already read your purpose, okay? You don't need the doses and these things, Dr. Nadeem, please. Here is Sana Fauda, please. Are you doctor or nurse? Are you there? Miss Sana, are you there? Miss Sana, are you there? If you're not there, I will not mark. Are you there, Miss Sana? Yeah, okay, great, great, good. On this date, Miss Walter was brought to emergency department, hospital. No need of emergency department, okay? A and E is enough, no need of hospital, okay? Presented with severe, painful blistering. No, this is not good. Blisters, painful blistering. No. On the right face, on the right side of her face, neck, and back, related to chemical burn. Just mention, please, chemical burn, how it happened. We should mention it clearly, okay? Her skin lesion has been managed. Please don't use present tense in the past visit. This is past visit. Her skin lesions were managed, and morphine was prescribed. Apart from having shortness of breath, she was otherwise clinically stable. No, this is not good. Please improve. Miss Sana, we need a lot of improvement. Tomorrow, I will show my model answer. Tomorrow, Dr. Mashahid, wa alaikum assalam. Thank you. So tomorrow I will show my model answer and we will write together. So this is not good, Miss Sana. Okay, please improve, Miss Sana Fauda. Please improve. So, Shamu, Miss Shamu, please. Are you there? Are you there, Miss Shamu, please? Or Dr. Shamu, I don't know. Okay, so are you there? This person is there? Yeah, great, great. Okay, so your purpose is here. Very good. I'm ready to update the follow-up of, no, update the follow-up to update you on, please. No, this is not good. Okay. I'm ready to update you on Miss Walter, a 60-year-old woman, lady. So this is not good like this. We need hyphens. We need lady, woman, or the profession here who has been treated for a second degree burn. This is not a single burn, please. A is wrong here. A no, article A no, burn single no. Second degree burns, plural, and post traumatic. Between post and traumatic, we need hyphen depression after domestic violence for further follow up and care. Please write in 2 sentences. Please write into, no, don't worry at all. If you go to YouTube, search, there is one video of mine on YouTube. If you search just DrChe and plus name of your exam, okay, just 3 words of your name of your exam. I will not tell here because due to some problems, just DrChe plus 3 words of your exam. If you search in YouTube, if you search on YouTube, you will find my channel there. Okay, and you can there is one video about how to write purpose. Please watch it. The new people can watch my YouTube videos. Okay, so anybody has any question? Let us just finish the class. It is already too long class. I think you people are learning something on daily basis. Okay, so the main thing is we need to learn. Okay, we need to learn. By the way, you people can, this is the best Miss Naseem has written. She is my student, Miss Naseem. She has written very good. You can see in the comments, you can copy. Okay, that is enough for today. If you have any questions, please ask me on my WhatsApp. Okay. So what we should do tomorrow before we leave, before you leave, please, if you start the class with me, don't leave, because sometimes I need to see a patient. I go for 5 minutes and then when I come back, there are only half of the people. So this demotivates me. It would result in very short classes. Maybe I will stop taking classes. Okay. I'm just doing this free of cost. So if you people don't cooperate, okay, if you demotivate, then this would not go. Okay. My YouTube channel, you can just search DrChe plus name of your exam. So what we should do tomorrow? Tomorrow we should complete this letter. We should do speaking. What we should do tomorrow? We should complete this letter, or we should write. We should do speaking. Tomorrow we should complete this letter. Thank you so much, Dr. Nadeem. Tomorrow we should complete the letter, or we should do the speaking. The majority of the authority, let us see what majority says. Let us complete this letter, or we should do speaking. Please let me know. We should complete this letter tomorrow. I will write, okay, I will write my own purpose. I will show the model answer, all of these things. So then we can do speaking day after tomorrow on Monday. Today is Saturday. So we can do speaking on Monday, and tomorrow we can complete the letter if you wish. Let us see the majority of the authority. So tomorrow we will complete the letter because most of you are saying this. Okay. So one thing, can you people invite at least one student for the class? At least one student. Who can invite at least one student for the class? Who can invite at least one student with you? At least one student with you for the class. I will complete the letter. I will show you my model answer. My model answer is here. You can see here. This is model answer. This is model letter here. I will show you model answer. Who can at least invite one student who is preparing for the same exam? Who can invite at least one student for this class? At least one. Okay, Dr. Nadeem can. Miss or Dr. Aleta can. Only 2 people can invite one student. Only 2 people can invite anybody else for the class? People, you need to motivate me. Yes, you appreciate my time. That is very good. But you also need to cooperate with me. Invite at least one student for tomorrow class. Invite at least one student for tomorrow. Yeah. Thank you, Benjamin, Dr. Benjamin. Miss Saika will try. Very good. Okay. Miss Naseem will try. Thank you. Okay. Miss Florence will try. Can we write word previously in OET later? Can we write word previously? Previously is not good, Dr. Hazel. Not good. Miss Somia will try. Miss Lelu will try. Miss Rima will try. Miss Hiba will try her best also. Thank you so much, all of you. Tomorrow we will complete the letter, and day after tomorrow we will do the speaking. Okay. Thank you so much. Thank you. Your answer, Dr. Yusufzai, you can ask me on my WhatsApp, Dr. Yusufzai. You can ask your question on my WhatsApp, please. I cannot take all the questions because it is becomes too long class. Dr. Yusufzai, you can ask me on my WhatsApp, okay? Miss Princess will try to invite one. Thank you so much, all of you. Thank you. Please try, okay?